I was just doing that out of habit. Did you start?
Yes, I did. With all the extra stuff, yes.
Okay, that's fine. So we're doing donning PPE, emptying a urinary drainage. Hang on, emptying a urinary drainage bag with hand washing, and you can go.
Number 1 is perform hand hygiene. Number 2 is unfold the gown. Number 3 is don, put on gown, fully covered torso and wrapping gown around the back.
So that means I'm fully covering my torso. I'm not leaving it like this. I'm gonna wrap it around my back. It said to tie at the
Or
waist.
is fastened at the neck and waist.
Okay, neck and waist. Okay.
Mhm.
So if I wanted to go in order how it says, I would do neck, and waist. Okay?
5 is put on goggles or face shield appropriately over eyes or face. 6 is put on gloves. 7 is extend the gloves over the wrist of the gown. Number 8, you're going to explain the procedure to be performed to the resident.
Hi Frankie, my name is Sarah and I'm going to be your aide today. I'm just going to be
Provide
emptying your
privacy
drainage
for
bag.
the resident for privacy curtain. Raise bed between mid-thigh and waist level.
So I think it doesn't say to gather my supplies for
It
some
does
reason, so
not.
I'm going to get my supplies before I go raising any bed.
Okay.
I always do. You can use a towel or a washcloth. You know what? I'm actually going to use a towel. Maybe.
Place a barrier on the floor under the drainage bag. Place the graduate on the previous placed barrier.
Oh, I need the empty one. Thank you. And I'm going to need an alcohol wipe. So before I go touching the bag, because that's contaminated, it has urine in it, I'm going to get my supplies ready. Got my table here. Okay.
Open the drain to allow the urine to flow into the graduate until the bag is empty.
Okay, so I'm gonna,
Avoid touching the graduate with the tip of the tubing.
so I'm gonna pretend the bag was low. Like
Oh,
it's
and it
supposed to
does say for 16, wipe the drain with an antiseptic wipe after the drainage bag is empty.
be. So I'm gonna go ahead and
Oh, I'm sorry.
that will not happen. Oops, crap. Okay, so that won't happen. It's gonna be locked. So you can come in. My bad. We're also recording. Just be warned. You'll be on YouTube. So I'm gonna
You'll be on YouTube.
put this down, and that wouldn't have happened. But that's why I have a towel.
Right.
Because if I had a washcloth, that would have been everywhere. I'm also gonna need a new alcohol wipe, but we're gonna just pretend that didn't happen. So empty it, pull it down, and then you're gonna drain it.
Replace drain and holder, lower bed. Oh.
Okay, thank you. You're doing great. So I'm just gonna, you can even back it up a little. Go. Okay, now I'm gonna take this, and I'm gonna go ahead and lock it. So that doesn't happen. Twist it, one time down swipe, and replace it into the drain holder. Now what?
It says place drain in the holder, lower the bed, place graduate on level flat surface. Then 20 is with graduate at eye level, read output.
So I'm gonna lower the bed before I walk away, always, right?
And you're going to empty the graduate into the designated toilet.
Alright, so I'm gonna walk in here if you can follow me. I'm gonna set this on a flat surface. If you carry this in your hands, you can throw it out at this point, or you can wait to throw it out later and leave it there on your towel. So I put it on a flat surface. I'm not holding it up in the air to measure it. I'm gonna go down here. I'm gonna call that 325. Personally, I like to say it out loud because I feel like I'll remember it when I go out there better if I hear myself say it. So that way I don't draw a blank in case I'm a little nervous. But I'm gonna empty that into the toilet.
Then you're going to rinse, dry, and return equipment to storage.
course I rinsed it real good.
Leave resident in a
I'll put this back
position of
where I found
comfort and safety.
So I'm here pretend this was probably be on the toilet in the bathroom. And then I'm gonna clean up my linen.
Then from record your output on the provided previously signed recording form.
Now, I'm going to, I can write that down. I'm gonna write 325, my name, my signature, 325 ml, okay?
Now you're going to open the privacy curtain.
But before I go doing that, I forgot to give Miss Colite. Here, Frankie, here's your Colite. He's in position of comfort. I'm gonna open the privacy curtain. What
Yes.
else?
Maintain respectful credit in personal interactions at all times. Place the call light signal device within easy reach of the resident. Remove gloves before gown, turning inside out and stay removed. Dispose of gloves in designated container. Remove goggles in designated container.
There will be an empty base in here for you to set them in.
Remove goggles or face shield from the back by lifting the ears, pieces, or headband.
Okay,
Place
so-
goggles or face shield in designated container.
So that means I don't want to pull from the front. I don't know if I did that. Pull from the side, because pretend that we got like this to protect us, and if we have germs on us, it's probably here to touch on the sides.
Then you want to unfasten the gown at the neck first.
Okay.
Then unfasten the gown at the waist.
Okay.
Pull down away from the neck, touching only the inside of the gown. So go up under it. Once you unfasten that one, she might need help, guys.
I might have it.
You ready to get
Got
out
it.
of it?
Thank you. Okay.
I said, did you
So I untied it. I'm not gonna want to touch the outside of my gown. I'm pretending that I'm just coming out of a room that somebody has seated, and it's super contagious, and I don't want to get that. So I'm gonna push out like this.
Turn down inside out and roll into a bundle. Dispose of gown in designated container.
Put it in the linen, which is yellow.
Now you're going to turn on the water.
And now I'm gonna go wash my hands because I
Wet
got
all surfaces
urine.
of the hands. Wet wrists. Apply soap to wet hands. Rub hands together using friction. While hands are not under running water, rub hands together for at least 20 seconds.
Guess what, guys? You can see the clock in the mirror.
Oh, that's good.
You could even watch the clock.
I'm happy you realized that. Interlace fingers pointing downward. Wash all surfaces of hands and wrists with soap. Rinse hands and wrists thoroughly under running water with fingers pointed downward. Dry hands and wrists with clean paper towels. Immediately discard the paper towels in the trash can.
Okay. So I think it's been 20 seconds.
And then you
I didn't really
turn
look at
off
clock.
the faucet with
And
a
when I
clean
rinse downwards,
paper
that
towel.
means this way. Because I want everything to fall off my hands as opposed to coming back down towards me. So I'm going to go down. And no flicking. I know it's a very hard habit to break. So while you're doing your clinicals, sorry, not clinicals, while you're doing your training, I want you to practice hand washing the right way every time.
Okay.
Get in the habit, because if you do that, you will be golden when the test comes. I'm gonna turn that off. And obviously, if you needed a second paper towel, you could use it. Probably could use it. You want to make sure it's completely dry, otherwise that's an infection control issue. That would have
Do
recontaminated my
not
hands if I touched
recontaminate
my
hands
hair.
at any
just for the
time during
record.
the hand washing procedure.
So don't touch your hair, like I just did, because I did. So you're gonna put your hand. A good thing to do. You can put your hand behind your back like she did, and go ahead and exit. All right, you can end it. Thank you.